Welcome, everyone, to the SHOPS Plus End of Project Technical Series. I am Elaine Menotti from USAID Washington's Office of Population and Reproductive Health, and a Grievance Officer Representative to the Sustaining Health Outcomes through the Private Sector Plus project. Like many, I am joining you here from my home, where we've all been for much of the last 15 months. And while in the past we may have done more in person, we hope that this virtual format will connect us with even more people doing this work every day. As part of final dissemination activities, SHOPS Plus will host a 4-part webinar series sharing some of USAID's global investments in country programs, working to improve health outcomes along with a diverse array of private sector actors. USAID is a long-standing supporter of private sector health programming and is committed to investments in private sector engagement for family planning and other health areas. We use a broad definition for private sector in health, considering both the not-for-profit and for-profit entities of the private sector. We recognize that the private sector has an important role to play as a healthcare partner. In family planning, we see private sector contributions in areas like increasing the number of available providers of products and services, expanding coverage, improving consumer choice, providing resources and expertise, offering new models and ways of working. When public sector access may be constrained, we know that private sector facilities and outlets fill gaps and prevent interruptions in the provision of health products and services, like in fragile settings and during the pandemic we have been living through. How do we get there, and how can we do this work? From countries where private sector is more nascent to settings where the private sector plays a more significant role in health, the core principles are the same. It requires sustained attention and commitment, developing a foundation of trust across the sectors, regular and proactive inclusion of private sector actors in decision-making and planning spaces, supporting productive dialogue towards solutions that consider and meet the needs of both sectors and, importantly, those of the users themselves. We chose these webinar topics in the series based on common challenges we see across countries around how to better and more strategically engage the private sector in healthcare, specifically around stewardship, financing, and market development. We will share successful examples, results, and lessons learned from over 6 years of country programming and look to what the future holds. Thank you to SHOPS Plus and its partners and staff around the world for their work to put this series together. I am pleased to kick this series of events off with you, and I hope you will join us. Thank you.